And here with us now, as mentioned, board-certified dermatologist and founder of M Beauty Clinic, Dr. Tess Mauricio, to give us some summer skincare tips. Always a pleasure to see you, Dr. Tess.
Thanks for having me, and thank you, Mark.
Yeah, Mark.
Oh, sweet.
Awesome. So, right off the bat, sunscreen is sort of your anti-aging superpower. Explain what you mean.
Absolutely. So, summer, we're in San Diego. We basically have summer-like weather throughout the year, but of course it's going to get, hotter and more intense, and you're going to have more sun exposure. You're going to get a lot more UV exposure. And like you said, SPF sunscreen is really going to protect your skin from sun damage, wrinkles, pigmentation, but also skin cancer. So make sure most people do not apply enough sunscreen, only about maybe 25 to 50% of what they're supposed to. Also reapply your SPF, and you want it to be 30 plus and both covering UVA and UVB, and that's what we call wide spectrum sunscreen. And also, again, there's no waterproof sunscreen, so you want to reapply. And don't forget, it's not just for your face. You want to put it, for men especially, ears, neck, back of neck, chest, and any area that's exposed.
Let's talk about summer breakouts. They're the real deal. So what do you recommend to deal with that?
We're definitely seeing a lot more acne around the summertime, and that's because, you're sweating, you're putting sunscreen, you're clogging your pores. And if you're acne prone, that really can cause a trigger. And then a lot of people, what they do is they actually use more salicylic acid, benzoyl peroxide. They're washing their skin because they want to, the oiliness to go away. And that is actually going to strip your skin off the moisture and can make acne and breakouts worse.
Talk about hyperpigmentation. We hear this term, and it goes up during the summertime. So how do you battle it?
Well, if you have conditions like melasma, which is like the mask of pregnancy, or any skin discoloration issues, it will worsen with more sun exposure. And so the good news is that we do have incredible treatments at the clinic, like the brand new Pico laser, to really address this, and combination therapies. But this is the time to really look for tinted sunscreens with iron oxides, and then also use vitamin C topical. We recommend IV glutathione and vitamin C in the clinic as well. And just make sure to understand that not only is it UV, but also heat.
What about treatments to sort of reset your skin?
Well, there's a lot of treatments that we offer at M Beauty Clinic, and now is the time to really think about hydrating facials, like the hydrofacial. Also, maybe think about regenerative treatments like microneedling with platelet-rich plasma, exosomes, things that don't have a lot of major downtime. These are maybe 24 hours that you're red, and then you're ready to go back out there.
Let's talk about the entire body. It's not just your face, it's really the whole body, right? Yeah.
We're showing more skin, and they're incredible treatments now to, address like sagging skin, especially if you're losing weight, using GLP-1s. We have radiofrequency treatments. There's ZERF, which is the latest technology in non-surgical skin tightening for the face, for the body. We're using it for arms, for abdomen. So really the key is, if you have issues, face, skin, body, and hair, just like yesterday, we were at UTC with Extra Say, consult us. We offer free consultations. We'll give you your options, and then you go from there.
All right, Dr. Tess, always appreciate your advice. Thank you so much for stopping by on the holiday.
Thanks for being here.
All right, Good Evening San Diego returns after the break.